Hello, I'm Elisa Grace, VP of Coaching for Healthcare Experience Foundation. We are 1 week away from our Healthcare Experience Inclusive Leadership Certification Program. Excited to welcome you to our online cohort. We're starting on August 8th and we'll continue on August 9th from 12 o'clock p.m. Eastern Standard Time to 4 o'clock p.m. Eastern Standard Time. Topics include embracing the power of inclusion, dealing with challenges of disengagement in healthcare, and creating a positive, psychologically safe work environment. Already registered? Fantastic, and thank you. If you hadn't had the chance to register, there's still time. Just click in the link below. We look forward to seeing you next week, and thank you again for your time.
My name is Dr. George Mayzell. My background, internal medicine and geriatrics. And it's an honor to open up this conference. When I think back to, 35 plus years ago when I started in healthcare, things have really changed. And when I think about and really think about what's different now, why are we sitting here in this room or in the rooms that you're in, thinking about diversity, equity, inclusion, incivility, belonging, and all those type of things? I really think about some of the real changes in healthcare. We have totally new employment models. The idea of the independent practitioner, independent nurse practitioner, those days are really going away very quickly. Folks are now employed by hospitals. They're employed by what we call payviders, which is some of the managed care companies. And the newest kid on the block is private equity. So that changes the model a little bit to being a lot less inclusive with the physicians and other folks in the practice having as much input into the practice as they used to when we were all running our own practices. So that's a big change. Medical knowledge has changed. The most recent stats says that medical knowledge is doubling every 73 days. Can you believe that? Trying to keep track of that kind of medical information is really challenging. It takes time, energy, effort, and frankly, resources. So a huge change. There's huge time pressures now. Some of it's new, the compensation models, the new models out there. Some of it's the new employers. Some of it's just the demand of demographics with a lot more folks having chronic diseases and the aging population. So in places where I live, like Florida, huge demand to get into particularly specialists, but also primary care docs. So it's really challenging. Then we add to that some of the changes in what we used to have. Some of our outlets used to be sitting in the physician's lounge. A lot of healthcare was delivered, analyzed, and evaluated in the physician's lounge, usually before rounds in the morning, and just having those discussions. But now a lot of physicians don't even go to the hospital anymore. With hospitalists and intensivists and others, folks don't even go to the hospital. So the interaction is way down. Another great source of interaction that we used to have was the medical societies. A big part of my life early in practice, where we'd have a lot of social events and other interaction with fellow physicians and peers at these medical society meetings, events, social events. Those have really backed off much in the last many, many years. And the last not so subtle event is COVID. COVID changed everything. And as I say, COVID really peeled off the Band-Aid of things that were already happening, and really showed some of those challenges and things underneath that Band-Aid that we really knew were there, but we weren't really quite aware of. So the pressures and stressors and time constraints and all the other things that we now see in medicine were certainly all exacerbated by the COVID. And even as we're winding off it, I think there's still a lot of residual from those COVID days. So I don't have to tell you this, but it's difficult to be a clinician these days. It's incredibly demanding. It's a lot more demanding than, frankly, when I was started practice. And the healthcare is hard, but all the stuff around healthcare makes it even harder. All of the prior authorizations, the pre-certifications, the getting folks into other practices, all those things that really aren't necessarily patient care directly, but definitely affect patient care, are out there making it really tough to practice medicine. So we know that. And what we see is that burnout, which was definitely prevalent before COVID, now is even more prevalent. Greater than 50% of physicians, and that includes medical students, that includes residents, and that includes APPs and anybody practicing clinical medicine, we're seeing burnout is greater than 50% have some symptomatology of burnout. On top of that, we see incivility, which you're going to hear about in the next couple of days. We see, at least the numbers I've seen, not necessarily in medically related, but certainly include medical practices and hospital practices. 76% see one or more episodes of incivility each month. And when talk about witnessing, it's 70% see 2 to 3 episodes each month. So we're not necessarily very nice to each other, even though we mean to be. And a lot of it is the stress and pressures of trying to do a good job for your patient, all the pressures around practicing good healthcare. Nurse to nurse incivility is greater than 50% as well. So this is tough. So what we hope is that by making you aware through this course on diversity, equity, inclusion, civility, incivility, and belonging, and all the other things that go along with it, we hope that it helps you, bring you back to why you went into healthcare, makes you a better practitioner, brings back some of the joy that hopefully you went into medicine originally for, and at the same time, making you a better physician, a better practitioner, a better clinician. It gives a better patient experience as well. And we all know that if the physician and practitioner experience is better and the patient experience is better, the outcomes are better. And that's really what we're trying to get to. So the hope is all this is good for everybody, and just bringing us back to why we went into medicine.